Hey, Dave Doyle here again from Spectrum Physical Therapy. Hopefully you watched some of the videos that we posted regarding hip and hip mobility that Jerry and I will be working on. Let me just talk a little bit about what this will be used for. If you've been told you have FAI, which is femoral acetabular impingement, if you've been told you have maybe a labral tear, if you have some pinching that hip when you're coming down, either you're coming down into a squat or you're trying to flex the hip, you get that little pinch in there, this could be for you. Now, the thing is that this does not rule out that you need a good evaluation from a therapist or a doctor, because if you have some bony change in your acetabulum, which is that socket the ball goes into, you might have a lesion in there, or you might have something going on the head of the femur, that this probably won't fix that. Sometimes you do need some other medical things. But if you do have some issues on there, you got that gummed up hip, give this a try. Now, obviously, if you start getting some knee pain or hip pain or anything, I want you to stop. But give it a try. So what we're gonna do is we're gonna show you a couple mobility things. First one, if you guys have heard the frog stretch in yoga, this is gonna be a little bit of same thing, but a little wrinkle to it. So what we're gonna do, we're gonna attach a 1-inch band here. This has about 65 pounds of force. We've got some good resistance there. Attach it to a rig here, and we got some 45-pound plates, and we got some pads here for my knees, because when I do this, it hurts my knees. So this is what we're gonna do. We're gonna step into the band. What I wanna do, there's bones right in the front of my hips. Those are called your ASIS bones. I'm gonna put the band kind of right there, okay? Now I'm gonna come down onto an all-fours position. So this band's pulling me back a little bit onto the pelvis. Now what I'm gonna do is gonna get some tension on there. I wanna get my feet set up on these pads, and I'm gonna turn my feet in on both sides. So I got the plates there, pushing me back there. And all I wanna do, I wanna get that tension on there. I'm gonna sit down, lay down here, put my hands down here, and I'm just gonna allow that band to pull me back, and I'm just gonna hang out here 2 minutes. Whew. Yeah, this actually feels good, but oh man, brutal. So that's number one. Let's get out of this. All right, make sure you step back first so you don't kill yourself and run into your squat rack. That would stink. Okay, that's number one. Let's get rid of this. All right, number two. All right, we take the band again. This is one I know no one's ever done before. All right, let's pull the rings up out of here. All right, got some cool stuff. Hey, did your physical therapy clinic have this stuff? I don't know. It does. That's pretty cool. All right, we're gonna wrap the same band. I'm gonna wrap it around here. You just sit down for a second. All right, what we're gonna do is we're gonna take this band, we're gonna put it right in front, right in the knee there. What this is doing, it's taking my femurs, these long bones, pushing it right back into the acetabulum, which when the hip joint goes back into the acetabulum, it's a nice, good, protected position, because we want that ball centrated. A lot of times you get that pinch there, because what's happening is that hip is rolling anteriorly or forward. Get that pinch. So we want to push that femur back into the socket, make it feel a little bit better. Now, what we're going to do is we're going to hobble over to the wall. What I mean by hobble, we're hobbling. All right, let's get down here. I want to get my butt as far close to the wall as possible. Let me scoop up a little bit. Thanks, Jerry. Hang with me. All right. Lower back pressed flat against the ground right here. Nice, good, protected position. Want to get my about a 90-90 position here. Okay? I feel this tension. This femur's going right back into my socket. Feels pretty good. Now what I'm going to do, I'm just going to let this kind of pull me out. Just to the point where my inside of my heels, my arches start to just come off the wall. I'm going to hang out here for 2 minutes. Talk about a nice groin stretch. Whew, yeah. 2 minutes, babe. We're going to hang out right here. All right. That's number two. All right, number three. All right, let's go over here. This is a 13-inch step, so a little bit lower than a normal chair. So what this is gonna do, it's gonna help give me a little bit of some hip flexion. So I'm sitting down a little bit, so flex my hips. You guys have heard of that good old figure 4 stretch. All right, it's gonna be just even a little bit better. All you're gonna do, get in this position, femur's getting pulled back into the socket, good protected position for my hip. Bring this up and around. Yeah, there we go. There's your figure 4. All right, gonna hurt your knee, don't do this. Now, what I wanna do, up nice and tall, gonna lean forward a little bit, put both my hands right on my ankle joint here. I'm just gonna lean forward. All right, make sure I'm not rounding, up nice and tall. I'm gonna hang out here. How long? Let's go 2 minutes. That's a long time. Both sides, obviously, right? Okay, that's number 3. All right, let's unstrap this. All right, let's get rid of that. Let's do one more. Now, let me show you something real quick. Follow me, Jerry. All right. Now, you saw a little whiteboard. You had the Thomas test. What does Thomas test mean? All right, show you what it is. All you have to do is find yourself a table. You can find anything you want. Find a bed. You're gonna get about halfway on there. I'll show you how bad mine is. So if you wonder what's the Thomas test, that's what it is. I'm gonna lie flat. Okay. Now, if I pick up one leg and I want to take my knee, pull it up, this should stay flush against the table. Watch mine, guys. Beautiful, huh? Oh, yeah, there you go. That's not supposed to happen like that. That's called the tight hip. All right, no bueno on that one. All right, the other side. Oh, awful. All right, so we're gonna fix that. Let's do this. I got tight hips. So, got a 10-inch step right here. Some people might be able to do a little bit higher. You might be able to put your leg up on a box, anything like that. I can only do a 10-inch step. So what we're gonna do, foot's gonna go up here. All right, nice and tall. This is gonna get a little some hip flexion on my left side. I'm gonna tighten up my glute on my right side. And I'm gonna just press down a little bit onto the leg here. Make sure my foot's in a good position. I'm gonna hang out right here. I should be getting a nice good stretch right through that hip flexor. Hang out here. If you want to add a little bit of wrinkle into this, take this right hand, come away a little bit. Oh, feels good, maybe. All right. So, get out of there. Obviously, you're gonna do both sides. So those are 4 exercises I'll be doing for the next 2 weeks. And then what we're gonna do is we're gonna recheck my measurements. That's what we're doing. Thanks guys for checking in, and I'll talk to you guys soon.